Hello, Ivan, and all the team at Karl Dietz, because I know we spoke briefly before the holidays, and I said I would send some information. I thought this was perhaps the best way to do it, that you can watch it in your own time. What I'm going to go through today is just a bit of background on Seating Matters, who we are, what we do, and why I think Karl Dietz might be a good company for Seating Matters to work with. I know your friends in Norway and Sweden and here in Ireland, Elite Healthcare, had recommended, and I've had a look at your website and I see some similarities there as well. So I just wanted to run through what Seating Matters are and see if there's some alignment and if it's something that you as a company might be interested in. I think we would be interested in discussing this further. So I'll try and run through this as fast as I can today because there's quite a lot of information, but happy to set up a call to follow this up and answer any questions you have. So to start with, I'm Jonathan Tierney, and Seating Matters was started by my mother, who is an occupational therapist, and this is her here. And really how we started is my mother was an OT, and she taught seating. She had actually wrote a book on seating, and she was teaching it in universities, in hospitals, in nursing homes. And because she was often the one that was teaching about seating, she was the OT that would get the referrals for the more complex patients. So people with serious pressure injuries, people who they couldn't get out of bed, perhaps spinal cord injuries, bariatric patients, that would often be referred to our mother. My father, luckily, was an engineer, and he started to custom make chairs for her patients when she couldn't get the right chair or couldn't find a chair that was suitable. So we would often adapt chairs, and then we started to custom make chairs. So my parents done that from about 2000 to 2008. And then in 2008, myself and two brothers got involved, and we made Seating Matters into a manufacturing company. And that's really how it began. So when we think about seating, sometimes as active people, we don't always understand the importance of seating. So I like to use this story of, or the thought of a long haul flight. So I'm sure many of you have been on a long haul flight, flying, across Europe, flying to Asia, Australia, America, and you've been on a plane, and what we say is the chair is one size fits no one. The chair's made the same size for everyone, and there's no adaptations, and really it's uncomfortable when you've sat there for a few hours. When the bell goes off, you see people getting up and wanting to stretch and move, and even while you're sitting in the chair, you'll change position often, you'll stretch your legs, and you'll make excuses to go to the bathroom just to get up out of the chair. And what I often say is, if you think of the last time you were on a long haul flight, how would you have liked to get back on that flight the next day and do it all over again? And then the next day, and the next day, and the next day. And that's what we find our patients are doing every single day of their life. They're doing the equivalent of a long haul flight in a hospital, in a nursing home, maybe even in their own homes. So at Seating Matters, we want to change that. So you'll see the lady in the before picture, the way she's sitting, she's slouched in the chair, she's falling, sliding forward. And this is Seating Matters' most simple chair, the Monaco. We have her in afterwards, and you can see how much better she's sitting. She's sitting upright. You can even see the expression on her face. She's got the posture correct, so she's not falling, leaning to the one side. And you'll see in that image something that she's even got a cup of tea. She's able now to feed herself. It's a lot more functional, a lot more comfortable. And I know if that was my mother or grandmother, I know which image I would prefer to see. So that's really what we want to do here at Seating Matters. And this is one of the most simple examples, but it's still very profound. And thinking of that long haul flight, this is going to be a much more comfortable way to live day in and day out. So the quality of the person's chair that's sitting in a hospital or in a nursing home, the quality of the chair really does determine the quality of their life. So we understand, we understand that in many markets around Europe and around the world, that seating hasn't been adopted the way perhaps the beds and mattresses are. And in order to change that thinking, we need to challenge core beliefs. We need to challenge that seating isn't just a chair, that seating does impact a person's quality of life, that it's not just furniture. Often we'll go into a hospital and we'll see the bed is very clinical and medical, but the chair beside it is more for the visitor or the guest. So often there's a mindset there, or historically there's been a mindset that the chairs aren't as important as the bed. There's a mindset around pressure injuries when people have difficulty that they want to leave them in bed. And we would challenge that and show we can prove that that is. People think that seating doesn't cause harm. You know, it's obvious when you see the types of chairs that are in hospitals that there hasn't been the same clinical thinking gone into it as there perhaps might be towards the bed and the mattress. But we know that pressure injuries occur from people sitting. And over the last number of years, a lot have done a really good job of providing the right bed and the right mattress to help prevent pressure injuries. But the incidence of pressure injuries isn't declining the way it should be. But what is happening is where they occur is actually changing. So you can see that more pressure injuries are now related to the seated position than to the bed. And that's something that we want to help with. So pressure injuries is obviously a very big topic for us when we're talking about seating. But this is a slide that we borrowed from Professor Michael Clark. You may know that name. He was the last president of the European Pressure Ulcer Advisory Panel. And if you've seen him talk, this is directly from his slides. And I asked if we could use this because he said posture can kill. He says it's not something that's often thought about, but if you go back and think urinary tract infections, pressure injuries, you know, how breathing is limited, respiration, digestion is all limited by posture, and it's leading to things that are causing early death. And that's something that we know the correct chair can help with. And posture and pressure injuries are inextricably linked. So we know that if someone's falling to the one side, or they're sliding forward in the chair, or they're not loaded properly, that the posture can cause pressure injuries. And that's something that we know at Seating Matters that we can help with. So a big thing for us is that when we look at the hospital room, you'll see that every piece of equipment in that hospital is clinical. It's being decided by the nurses, by the doctors, by the therapists, what type of bed, what type of mattress, what type of safe patient handling lift, what type of bathing equipment is being used. But then the chair is often a piece of furniture. And my argument would be that the diagnosis doesn't change between bed and chair, or between lift and chair. So we can't lift someone safely out of bed using a safe patient handling lift and put them into the wrong chair and think that that's okay. So what we want to do at Seating Matters is create that full room solution. And that's where I think when we look at your website and the other pieces of equipment that you're doing, we could allow you to offer that full room solution to your customers. So when we look at Seating Matters, what problems do we solve for our customers? It's looking at the incidence of pressure injuries and helping to reduce that, reducing the risk of falls, helping to get bariatric patients out of bed, reducing hospital stays, and getting people out of bed that have been in bed for long periods of time, and increasing their mobility. So early mobilization, getting them up out of bed, and hopefully getting them out of the hospital quicker as well. So I like this photograph, and especially when I look at your website, I see that you're doing beds, you're doing mattresses, and something that you can see here is this lady is on, you can see the pump at the end of the bed. She's obviously on an air mattress for pressure injuries. She's got the boot here on her leg because she's obviously got pressure injuries on her heels. But then they've put her in a chair with a metal leg rest, which doesn't make any sense. It doesn't take a wound care nurse or a clinician to understand that the skin that's already broken going onto a wheelchair with a metal frame isn't going to help that. So what they've done here is they've taken this person out of bed where they've got the proper mattress that like you provide, and they're putting them into something that is taking them back a step. So it's breaking that cycle of care. So at Seating Matters, when we look at proper clinical seating, we look at the 4 principles of seating. And we say that in order for a chair to meet the correct clinical level of therapeutic seating, it has to meet all 4 requirements. So I'm going to run through these quickly. The first is loading the body. And this is where we want to load the body in as many areas as we can. So a good example of this is loading the feet. If the feet in a normal seated position take about 20% of your weight, and when we don't have the feet loaded, that's an extra 20% that's going on to the high risk areas like the ITs or the sacrum. So when we say loading the body, we want to make sure that the full body is loaded correctly. The next one that we talk about then is postural support. And we talked about how posture can affect a person's livelihood through their breathing, their digestion, elimination. So in all our chairs, we've got good posture support where we can bring in the laterals like you see here. We bring in support for the head for people that are falling to the side, helping with scoliosis, kyphotic postures, spinal cord injury, and people with a lot of muscular difficulties where they don't have the strength to sit up properly. Our chairs will take that hard work that it takes to sit and make it a lot easier for them. And then effective repositioning. This is something that you'll understand from the mattresses. We're having the change in position of where the pressure's going. We do that through tilting space. So when we tilt the chair, our chairs tilt to 45 degrees. That offloads the weight going through the seat and the high risk areas by up to 47%. So we're almost halving the risk of pressure injuries in that area, or as the nurses like to hear, we double the amount of time that someone can safely sit out of bed. And then the last thing we look at is the cushion. And I know you'll know all about cushions. You've got some really good products in your range. But we always say that the cushion should be the last thing you look at because it's really, really important. But we find that most people only look at the cushion and they're putting a cushion on the wrong chair and not helping to load the body, not creating the posture support and not creating the effective reposition. And sometimes then the cushion can cause a problem because it changes the height of the chair or it leaves the seat unstable. So for us, the cushion is vitally important, but it's like having a car with one wheel. We can't have it on its own. It's a part of the full jigsaw. So the safe patient handling is a big area that we can help with. And like I said earlier, what we find a lot is a lot of thought goes into the bed and the mattress, which you'll be aware of, and then they'll buy a lift to help the patient, to help the staff move the patient, but often they're putting them into the wrong chair and causing problems that the bed and the mattress have been designed to adjust. And 80% of chairs are not compatible with the lifts. So at Seating Matters, we have designed our chairs to be fully compatible with the lift, be it a full lift transfer or a standing lift like this one in the image here with the Milano. So you'll see, for example, we've made a cutout on the arm. The chair sits nice and high that you can get the lift underneath and be able to place the person right into the back of the chair safely without hurting the caregivers and the nurses. We help with bariatric. I'm not sure if that's a big problem for you. I had a look on your website and I didn't see a lot of bariatric equipment. So if that is an issue, happy to discuss that on our call and how we can help with that. But we do have some of the best chairs designed for bariatric patients. And I personally am a big advocate for getting the bariatric patient out of bed, helping with their mental health as well as their physical health. And we have really unique features designed in our chairs to help these patient group. And then wound care. This is really where I see a lot of alignment between your products and our products. And this is why you were recommended to us, because of your links with your mattress company. But what you'll know and what you'll see is the chairs don't match the requirements for the mattress. So if you were to walk into a hospital with a mattress with a vinyl covering, for example, it hasn't been used in hospitals for years, but yet they still put that same patient in a vinyl chair, because the most clinical thought that has gone into seating in most environments is around infection control. But they haven't thought about adding the Dartex and the memory foam and creating that pressure care while they're in the chair. So what happens then is they break that cycle of care. They're doing a really good job in bed at night. They lift the patient out and undo all that good work, which stops the repair of the tissue. It slows down any recovery, and it slows down the discharge from hospital, so they end up with longer hospital stays. But at Seating Matters, what we do is create that full 24-hour cycle of care by providing a clinical therapeutic chair that matches the level and the quality of the bed and the mattress surface that they're using during the night. So I want to just looking at your website then, I see that you're doing these beds, and that's very much the same customer that we talk to. So I would be talking to people who are prescribing the beds, as well as the mattresses that you're doing here. So this is very aligned with what we're doing, because we're always talking to wound care nurses, and the person that needs this more, even in the higher end here, the person that's using these will need the correct type of chair when they get out. And then I also see that you're doing cushions, so very aligned to us again, and you're even doing some seating. So the electric wheelchair market excuse me, is very different, but there's some crossover, and there's also similarities. If you're already providing this type of chair, you'll know how to do the seating assessments and prescribing the right chair. So I do feel, looking at your range, that Seating Matters would have something to offer to fill that full room solution that we talked about, and to give your customers even more options, and to give them something that maybe other companies doing this type of product can't provide for them. So I just wanted then to go over some of the research, and we can go into this in more detail at a different time, but to run through it quickly. We have different research trials the whole way from independent trial from a university at the top, right down to case studies and patient caregiver testimonials. So some of the highlight figures here is that in a nursing home trial that we done across 3 different nursing homes, we actually had an 88% reduction in pressure injuries. We had a reduction in staff time, reduction in sliding or falls from the chair, and increase in oxygen saturation levels within the blood. We repeated this in a hospital because the nursing home study was done over a 12-week period, and we know that our hospital patients aren't in bed that long or in the hospital that long. So this study was done over a 7 to 10 day period, and you'll see a lot of very similar results. So instead of an 88% reduction in pressure injuries, we had a 75% reduction, but still massive when you think of the shorter time frame that we had to impact change. We had a 100% reduction in sliding and falls from the chair during the hospital trial. And this is some of the people that were in bed, could not get out, and now they're sitting out for 5 hours a day, 8 hours a day, 3 hours a day, helping with that early mobilisation, helping hopefully to discharge them from hospital. One of our chairs, we have a Class 1 accreditation for dementia care. So if you're providing nursing homes where they've got the locked units, our Atlanta chair is designed specifically for that. We've got the accreditation, and we've lots and lots of research around helping reduce falls, reduce agitation, reduce medication with dementia patients. And this is an example of someone who's sliding, falling out of the chair beforehand, even needed a lap belt, which we wouldn't encourage and often isn't allowed, and having them in the Atlanta chair they didn't need that and they were sitting a lot more comfortable and safe. We also have a chair for ICU, which is designed for early mobilisation, getting people that perhaps you can't often get out of bed, like intubated patients, spinal cord injuries, burns units is another area where we use this. And we know that this helps because people leaving ICU have acquired weakness up to 5 years after they leave the ICU. And we're helping to reduce that by getting them up and doing that early mobilisation. Sometimes they're still sedated when they're sitting in the chair, but the chair's doing the work for them. So that was a quick run through seating matters. I hope that is enough to generate some interest for a further call. I'm happy to get on. I can run through this again, answer any questions that you might have, and really look forward to speaking to you. Thank you very much.